set up there. This morning here, and so I would like to talk about what I call the P word, mental health stigma and awareness. Our world continues to fight against a global pandemic, and of course, one second here. All right, I'm sorry about that. My screen is back. Okay, our world continues to fight against a global pandemic, diabetes. The number of people affected continues to rise despite our efforts to eliminate it. Our world, of course, is also continuing to combat the COVID-19 pandemic. And here we see the numbers that continue to grow for people affected by diabetes, as well as the burden on the cost and living for people. Many have been faced by the loss of unemployment and financial struggles, decreased access to healthcare and education, shortages of food and supplies, and a lack of social support. It is not surprising that this has increased anxiety, depression, substance use, and exacerbated other pre-existing mental health issues for many. This is alarming for people with diabetes, especially as there was already a significant higher risk for depressive symptoms compared to the general population. And these depressive symptoms, we know, are associated with higher A1C, increased short-term complications, and increased risk and progression of complications that in turn can further exacerbate mental health issues. Individuals have reported significantly lower health-related quality of life and more mental health challenges than before the pandemic. And this impact has been greater for children. People with diabetes who experience higher levels of worry about COVID-19 could be more vulnerable for diabetes distress, hyperglycemia, depression, and anxiety. And awareness for the emotional well-being and support has been more important than ever. Let's take a look at one basic need: food. Adults who experience a disruption of food intake or eating patterns due to the lack of money, excuse me, and other resources may be at an increased risk for a variety of negative health outcomes and health disparities, such as increased risk for obesity. Food insecure households have a higher percentage of adverse childhood experiences, including many that you see on this slide: mental illness, addiction, domestic violence. Food insecurity is also associated with poorer mental health and specific psychosocial stressors across global regions, independent of socioeconomic status. This includes negative mood, anxiety, some reports of increased risk of schizophrenia, and negative emotional status. People experience all of these emotions, and it's reasonable that it has an impact on all aspects of life, including one's diabetes management. And so here we see diabetes in the center. We have various aspects of life. Life has been impacted by an overlaying pandemic, which has exacerbated for many stress, anxiety, depression. How many among us, including our patients, are feeling lonely, lost, angry, defeated, trapped, unhappy, and yes, depressed. Social media reminds us about the mental health impact on people with diabetes. As healthcare professionals, we are not immune to this impact, which I like to talk about, not just how we can take care of our patients, but also about the importance of caring for ourselves and for each other as healthcare professionals. Mental health conditions are among the leading causes of non-fatal disease burden in India. Since 1990, the contribution of mental health conditions to the total disease burden in India has almost doubled. And so we see that there are studies that have taken a closer look at mental health in various countries across the globe. Here, I researched some of the research that focuses on mental health in India and find that the statistics are not unlike the statistics in many other countries. If we take a closer look, we see that India has one of the highest rates of suicide in the world. I wish I could say that the rates were lower in even the country that I live in, the United States, but that is not the case. The United States rates are higher. Continuing to take a look at the rates in India, however, we see that more than 220,000 people die by suicide every year. And some statistics report that an astounding 1 student per hour dies by suicide. In 2017, President Ram Nath Kovind said that India was facing a possible mental health epidemic, and efforts were made to take a closer look and better understand the needs for all people. Again, it is not a surprise that the mounting mental health burden has had a negative impact on diabetes management and outcomes. What's even more concerning is the fact that access to mental health treatment is negatively impacted by stigma and limited or absent mental health resources. When we do not address the mental health of our patients, we risk undermining the well-being of the very people we serve, including our most underserved communities. This contributes to poor outcomes and higher risk for diabetes-related complications. We must take action, and this means that we must talk about the P word. We cannot avoid talking about the P word. And we certainly cannot afford questioning the existence of mental, emotional, or psychological issues. With this slide, I am reminded about the importance of words and how words matter. We have so many different terms that we use when we talk about the mental health or the emotional well-being of people. And used within a context, we sometimes are unintentionally exacerbating and or negatively impacting the very mental status or emotional status of others. Mental health conditions are often perceived with a sense of judgment, and there is a stigma associated with those having mental health issues. Stigma stems from lack of knowledge as well as negative attitudes and behaviors. According to Dr. Das, who is a senior consultant psychiatrist, president of the Indian Association of Private Psychiatry State Branch, and national co-chairperson of School Mental Health Division of the Indian Psychiatric Society, people with mental health conditions are amongst the least likely of any group with a long-term health condition or disability to find work, be in a steady long-term relationship, live in decent housing, and be socially included in mainstream society. When we add mental health conditions as an additional layer to the lives of people affected by diabetes, we can only imagine the impact and the effect that it has in each of these areas of life. Sometimes culturally, we look at people and we think about a continuum of a person being what we might refer to as quote unquote crazy or mad. And on the other side or the other end of the spectrum, normal. But we don't see the in between. We don't see that there are many challenges that people face. And this is really important. I'll touch on this in just a moment when we talk about myths. Diabetes can have a negative impact on one's desirability, in addition to the negative impact on desirability that mental health issues can have. And when I talk about the negative impact on one's desirability, it is the impression or perception that something is wrong or that there is something defective about the individual. As I was talking with some of my colleagues, we had a discussion and the question came up. For some, there was concern that the next generation, would be at risk for this lower level of desirability. Because what if there was a perception for a person with diabetes that the next generation would inherit diabetes? The question came up, could this be worse for females? For example, higher dowries could be demanded because in-laws would need to take over expenses. There was a broad discussion about this and many different opinions on this. And ultimately, the discussion circled back around to stigma and the impact that it can have not only on help seeking, but also on how we as health professionals can identify and provide resources or for support for the individuals who are experiencing a great variety of mental health issues. Simply having open and honest conversation about this can make a significant difference. It is key to start by building trust with our patients so that we can empower them to share these experiences with us. Not only can it be an uncomfortable conversation for us as healthcare professionals to start, it is also a difficult conversation for patients to participate in, to acknowledge, to admit that there are challenges for fear of how they will be perceived. And so trust becomes incredibly important, as does talking about mental health issues by taking into consideration the context and the cultural nuances for the individual, and also being open to saying things like, sometimes people report that they feel unwell, that they feel more tired, that they feel less motivation. Sometimes people report feeling unwell emotionally. This is not necessarily a defect. This might tell us that you have things that are happening in your life and you are not feeling well. What can we do to help? And so let's talk a little bit about what we can do. Really, it is starting with the basics. We can talk about it and promote awareness about mental health and related cultural beliefs. In doing so, it is key to address myths such as mental health issues are solely comprised of severe mental disorders. They are not. A guru can cure diabetes with herbs. Unfortunately, this is not the case. Another myth, type 1 diabetes is a condition in the Western world. Kids in India don't get diabetes. Unfortunately, this is also not true. How can we tap into these beliefs that people may have that then impact their diabetes management and what they are willing to do because they have very real fears and concerns? and beliefs related to diabetes and what it is and what it's not. One of the questions that I am often asked is, how do we really know if someone is feeling unwell emotionally? How do we really know if someone is experiencing, for example, depression? How do we know that they are not manipulating? And the answer that I give may not sit well with everyone, but my response is quite simple, and it is just ask them. If someone says that they are feeling unwell emotionally, if someone says they are feeling depressed or depression, while we may look at our lives or our life experiences and wonder, what in the world does this person have to feel depressed about? We have to remember that everybody's life experience and the way that each one of us perceives the world is unique to each person. And so one of us may have great strengths and may have thrived even with negative experiences having happened in our lifetimes. We cannot assume that everyone carries the same strengths. We cannot assume that everyone will deal with the same situations in the same way. We are unique. So if someone says they are feeling unwell emotionally, we must at basic level, take that as fact and proceed with trying to identify what can be done to support this individual. There are two things that we can start doing today with each diabetes patient. One, our standards of care with the American Diabetes Association calls for screening for depression once a year. If that is not something that is currently happening in your office or your clinic, that is a discussion that can happen and that can start. Number two, include more mental health professionals as members of the routine care team. Having a mental health professional as part of your routine care team can make a big difference, putting a face to the name of the profession so that people are more likely to see that as mental health professionals, we do not just talk with and work with people who have severe mental health issues. Yes, that is also an important part of the work that mental health professionals do. But we also talk with people living their lives who also experience struggles and who feel unwell emotionally at times. And for our patients with diabetes, this is a critical form of support that we must extend to them to improve their diabetes and health outcomes. As we go forward, we must remember that all people deserve optimal whole person care. All people must have access to the tools they need to optimally manage their health, and this includes mental health and emotional support. Talking about mental health is a start. Mental health has been a taboo, and the time has come for us to accept it. It is just as important as physical health, and they are closely tied and interdependent. And I'm hopeful that by bringing this topic up with you today, that it will spark some thought and some conversation as we move forward in the care of our patients with diabetes. Thank you so much.